Here you are dealing with symptoms that occur after eating. Getting those to go away would be helpful, but all your research has only left you unclear as to whether you're dealing with H. pylori or small intestinal bacterial overgrowth. These two microbial presentations are very different, even though they may initially appear the same. Let's talk about their differences and give you some clear path towards resolution. SIBO versus H. pylori. These are the two most commonly talked about microbial issues in the upper GI tract that are often linked to symptoms. Even though these two conditions occur in the same general region of the GI tract, they are very different. Today, I'm going to give you a straightforward way to differentiate between the two so you can find resolution of your symptoms. But before I do, allow me to introduce myself. I'm Dr. Arland Hill. For over 20 years, I've been helping individuals struggling with recurrent GI symptoms find lasting resolution by correcting the microbial balance in their stomach and small intestine. Let's start off by talking about the flow of today's video and what you're going to be able to walk away with. We're going to look at the differences between SIBO and H. pylori. We're going to look at what conditions that they are both linked to and what might give you additional insight into whether or not you're dealing with SIBO or H. pylori, how to diagnose it, and then also how to treat it both conventionally and with supplementation. So you'll walk away with a good understanding of the difference between these two conditions. Let's begin by talking about the differences in the organisms, and I'll start with H. pylori up first. So H. pylori is a bacteria. It affects about 50% of the world's population. So to say this is prevalent would be a bit of an understatement. But the severity of H. pylori, interestingly enough, even though we know more about it, actually a lot more about it than we have in the past, we haven't seen any significant decrease in how prevalent it is over the last several years. One of the things that that's an important point of differentiation for H. pylori as compared to SIBO is that when we talk about H. pylori, this is a single bacteria. It's just one bacteria. And it's a very significant bacteria in that we could classify this as a pathogen. No doubt when you hear the word pathogen, there's nothing positive that comes to mind about that. And indeed, that should be how you interpret H. pylori. This particular organism, it's very genetically diverse and it's environmentally adaptable. So let me say that a little bit different. This organism, you could have 10 people that all have H. pylori, but all the H. pylori in all 10 of those individuals may look slightly different. It may be slightly varied genetically based on the environment that H. pylori is functioning in. And that may not seem like a big deal initially, but it's actually a really big point because it ultimately leads us to the conversation around antibiotic resistance. And the more adaptable H. pylori is, or really any microorganism, especially bacteria for that amount, the greater the probability that it's going to develop antibiotic resistance. So we know that this is a big problem and we want to make sure that we don't run into this if we don't have to. It is classified as an infection. So if you're dealing with H. pylori or suspect that, you could inherently say you have an H. pylori infection. Now, on the surface, this may not seem like that big of a deal. It may just seem like semantics, how you're labeling and classifying things. It actually makes a big deal because infections should be eliminated. They should be eradicated 100%. That's not the case when we start talking about overgrowth. But hold that thought, I'm going to get there. The last point I'll make about H. pylori, just in terms of the organism itself, is that H. pylori changes gastric secretions. Now, this is another concept that you want to hang on to. What I'm referring to here is that, especially with the production of acid in the stomach, the gastric acid, hydrochloric acid specifically, H. pylori can change how that is secreted. It can initially cause an increase in acid production, and over time, what we generally see is that it decreases acid production. All right, so that's H. pylori. Now, let me contrast that against SIBO, and you're going to see how many things are different here. So SIBO affects 20% approximately of the population. Yeah, I would say the number might be inherently higher than that, but that's what the hard data on this says. So we're looking at H. pylori, that's somewhere around 50%, and SIBO is around 20%. Now, I mentioned that H. pylori was an infection. SIBO is not an infection. SIBO is an overgrowth. And in fact, to gain control over SIBO, you don't have to 100% eradicate it. You just need to get it back below what is an acceptable baseline. And this brings us back to another point, which when I mentioned H. pylori, I said, well, H. pylori is a single strain. It's a single organism. That's not at all the case with SIBO. SIBO is a collection of bacterial organisms that are overgrowing in the wrong location and that are exceeding what is considered an acceptable level or an acceptable threshold for them. So that's a different conversation than what we're talking about with H. pylori. In addition, these bacteria that are overgrowing with SIBO, well, they're opportunistic. They're looking to take advantage of a situation that has changed in their favor in the GI tract. So what would that change look like? Well, one of the things that's at the top of that list is that we would see a reduction in our gastric secretions. So think back about the acid in the stomach, enzymes from the pancreas, bile from the liver gallbladder. Those are all going to open the door for SIBO to proliferate. But remember, H. pylori directly changes gastric secretions. SIBO is a byproduct of these changes in gastric secretions, especially if there is a decrease in them. In addition, SIBO also manifests because of slow motility, the bowels not moving as efficiently as they should, not as routinely as they should. And again, you put those two together and you've got the perfect scenario for the outgrowth of SIBO from that. Now, we also want to understand what are some of the secondary conditions that can manifest from either H. pylori or SIBO. And here's the overriding theme on this. And that is that when we start looking at these microbial imbalances, these microbial imbalances open the door to dysfunction in the gastrointestinal tract that doesn't stay limited to the gastrointestinal tract. It doesn't stay limited to the stomach or to the small intestine. It begins to extend outward into the rest of the body. And now we have consistent evidence that shows connections between both H. pylori and SIBO for some very significant and chronic diseases that we need to be aware of. So let me start off with H. pylori here. And keep in mind, when we talk about H. pylori, it's in the stomach. And so when you're starting to see some very severe gastrointestinal diseases that begin to manifest, these are often secondary to inflammatory mechanisms that have been initiated as a result of what dysfunction the H. pylori is creating. And simply, as you look at this, and maybe simply is not the best word right there, but as you look at how this plays out, that inflammatory process resulting from the H. pylori changes the ability of the genetics to be stable and for the cells to replicate like they should. It induces the immune system and it doesn't allow an efficient clearance of the infection. So the immune system is overly focused on managing the inflammatory process, and it doesn't become as efficient at dealing with an infection as it may otherwise. We also see, as a result of this, as this starts to cascade along, this is where we start to run into the ulcer connection for H. pylori. This was one of the early associations made with H. pylori, and we know that it can result in gastric or stomach ulcers, or what are known as duodenal ulcers, which are the ulcers just below the stomach, just past the stomach in the upper part of the small intestine. That area is known as the duodenum. But it can result in ulcers in both of those regions. And even if this manifests on an ongoing, like if this continuum of disease continues to play out, this is where you can see what are known as mucosa-associated tissue lymphoma. Lymphoma is the key word you want to focus on there. Or you can see what are known as gastric cancers start to manifest from this as well. And this can be influenced by what are known as virulence factors. These are the secondary products, the byproducts that are produced by H. pylori that can be the potentiators of disease. But listen, that's everything that H. pylori is doing locally at the stomach, right? This is all stomach dysfunction that I'm telling you about. Well, what about outside of the stomach? Well, there are a number of conditions that have been associated with H. pylori outside of the stomach. You can see here many of these conditions that are prevalent, but then you also see additional observations as well, things like thrombocytopenia, iron deficiency anemias that you just can't seem to figure out where those are coming from. H. pylori is often a cause of that. The same is true for B12 deficiencies. These are called recalcitrant B12 deficiencies, meaning that they just seem to continue to proliferate on and on, irrespective of using B12 supplementation or B12 injections. These can be a byproduct of H. pylori. And something that I found very interesting about H. pylori, even though we know that H. pylori creates most of its damage, as I shared with you, in the stomach, this is by no means where that damage is limited to. H. pylori extends above and below the stomach. So what that means is that H. pylori has been isolated in the oral cavity. So the oral cavity has actually been identified as a secondary location for H. pylori. So when you start to think about, I have H. pylori, don't forget about what's going on in the mouth. If the microbial balance in your mouth is not stable as well, that could ultimately be seeding what's going on in your stomach and creating a lot of this dysfunction that we're talking about. In addition, that's above the stomach. What about below the stomach? Well, below the stomach, H. pylori has also been identified in the gallbladder, and it's been linked to individuals who have inflammation, chronic inflammation of their gallbladder. So if you're someone who eats a fatty meal and you have dysfunction in there, you feel pain, discomfort, maybe you've got fatty stools, those are all indications that you should be looking at your microbial balance in your small intestine and stomach, and don't forget to include H. pylori in that list. And so all of these things that I'm sharing with you as far as how H. pylori causes its damage, it creates problems because of how it directly interacts with these tissues. It produces toxic components that are irritants and that inflame these tissues, and it indirectly affects the immune responses as well. So H. pylori can be pretty nasty in regards to what it can do outside of just looking at the stomach environment. It's bad enough there, but it can extend out far beyond that as well. There's even links into, like I showed you with some of those conditions, Parkinson's disease is one that's gotten a lot of attention. So just to give you a significance of how much of a problem it could really be, well, that's saying something if it can be linked to Parkinson's disease. All right, what about SIBO? Is SIBO acting in isolation in the small intestine, or is it causing problems outside of the small intestine as well? Well, it's causing problems not just limited to the small intestine. So when we start talking about autoimmunity is strongly linked to SIBO. Whether we talk about arthritis, rosacea, so if you look at joint conditions, skin conditions, GI conditions, obviously, hypothyroidism, these can all be linked to SIBO. So we have to consider those. But the autoimmunity conversation is not simply where that ends at. Things like irritable bowel syndrome, fatty liver disease. So when you start thinking about breakdowns in metabolic function, how your body handles the food you're eating, and is it doing that efficiently or not? How's your liver supporting the process of all this? SIBO can disrupt that, and you can ultimately end up with fatty liver disease. And if that goes unchecked, that can ultimately play all the way out into cirrhosis if it continues on. And then lastly on this list that I'll give you, which is not an exclusive list by any means, is restless leg syndrome. In fact, look at the card here on the screen. If you think you might have restless leg syndrome and want to understand the connection to SIBO, check out that video. You'll find that one very insightful. So the point is that these two conditions, H. pylori and SIBO, they're going to affect a lot of other conditions that you may have heard about or that you may actually be dealing with. So let me ask, at this point, are you starting to see how much of a difference there is between H. pylori and SIBO? Well, if you're finding this information helpful, go ahead and give this video a thumbs up and hit that subscribe button so you continue to see more credible information to improve your health. Now, let's talk about diagnosis. I want to round this full story out for you, differentiating between these two, and to do that, we have to talk about the diagnosis and the treatment of these two conditions. So when it comes to diagnosis for H. pylori, understand on this that there has been a dramatic increase in antimicrobial response. So what that means is that's the whole antibiotic resistance conversation. And the reason that this is relevant is because one of the diagnosis processes for H. pylori is actually introducing a treatment protocol. And so many times practitioners, when they realize that they're dealing with H. pylori, the symptoms and the clinical presentation is matching up, they'll write a group of prescriptions for what's often called triple therapy: 2 antibiotics and an acid blocker. And if the patient responds to that, that's indicative that indeed they had a diagnosis of H. pylori and the appropriate treatment was chosen. Here's the problem with that, though, is we're starting to see that strategy, even though there was a place in time where that was a good strategy, it is starting to fail more and more because of antibiotic resistance. Whereas H. pylori may have responded to that in the past, it's no longer responding effectively anymore. And remember, H. pylori is a very environmentally adaptable organism. So we have to make note of that and not overlook that point. You can't, when you initiate a treatment with H. pylori, you can't go in half-hearted. You got to go full throttle and see the course of treatment through to make sure that you're getting rid of H. pylori. So this brings up the necessity, or the consideration at least, for the susceptibility testing for antibiotics. So is H. pylori, let's look at a sample of H. pylori and let's see what it inherently responds to, so that way we can match the antimicrobial treatment, whether that's antibiotics on the conventional side or whether it's antimicrobials on the non-conventional side. Match that up with that organism to make sure we have an effective treatment process. And this is possible with looking at what's called genetic PCR testing. And it's moving beyond the notion of, I'm going to take a culture of that H. pylori, I'm going to take a sample of it, I'm going to culture it out, and I'm going to see what it's responsive against. There's some benefit there, but that's ultimately limited. Now, in practical application, what does this really look like for you as the consumer, as the patient? Well, some of the previous testing out there has looked like breath testing. You can do what's called stool antigen detection. So you're looking for an immune related component, an immune protein that has been produced as a result of exposure to H. pylori in the stool. So that's another way you can do it. Or you can do, like I mentioned, the culture. So you take the sample and see if there's a problem. But ultimately, stool testing can be extremely beneficial here, because stool testing is using, if the right approach is used, if the right testing is used, that stool testing is going to use that genetic approach. And if you'll remember back earlier in the video, I talked about these virulence factors, which are byproducts of H. pylori that are produced, that we can start to see linked to specific pathways of dysfunction. You can look at these virulence factors with this genetic PCR approach that you can get from stool. Okay, so that's H. pylori diagnosis. Let's talk about SIBO diagnosis. And so the primary approach right now is considered breath testing. But breath testing is not as accurate as would be desired. It's not the perfect test. And perfect is probably not a good word to use there, because no test is perfect. But inherently what I'm suggesting on this is that breath testing can be of benefit, but you have to be conscientious about how hard you're going to lean on that. So it's helpful, but it shouldn't be relied on exclusively is going to be your takeaway here. There's also what's known as doing an upper GI aspirate. So literally taking a sample, going with a scope and taking a sample in the small intestine, culturing that out, and seeing what grows from that, seeing how much growth you have. That has its limitations as well, and it's invasive, so nobody's really signing up for that. So here's what I'm going to suggest to you are better ways to look for SIBO. So at the top of the list here, even though it is not an officially recognized strategy for looking at SIBO, is stool testing. And again, it's not officially recognized methodology here, and that's okay because we don't want to just look for the organism. We want to also identify what are the changes in the digestive function that open the door for SIBO. And that's important because that also tells you where you need to focus on with the second phase of treatment. If the first phase of treatment is going to be dealing with the overgrowth, the second phase of treatment needs to be what led to the overgrowth in the first place. In fact, at its core, SIBO is really more of an issue with digestive secretions than it is with the overgrowth. The overgrowth is a manifestation of the problem with the digestive secretions and the slower motility. So stool testing can help start to give us some direction in how to deal with that gastric secretion or not just your gastric or what's happening in the stomach, but also what's going on with the gallbladder and at the pancreas, and also if there's a microbial imbalance that could be contributing to the slower motility. Stool testing can answer that. But that's not where we should limit the conversation to. We can also do nutrient assessments here to get insight in terms of the diagnosis towards SIBO. SIBO is notorious for creating B vitamin deficiencies, fat-soluble nutrient deficiencies like A, D, E, K. All of those vitamins can be affected. Minerals like zinc and iron, selenium, lower protein levels. These are all nutrients, micronutrients and macronutrients that can be affected by the presence of SIBO that can be used as part of the diagnosis process. What about thyroid testing? Slow thyroid, hypothyroid, slows metabolic function. That translates to slower bowel motility. So we can also use testing that is more conventional, if you will, right? More standard types of testing to start to answer questions. Does this individual have the framework in which SIBO could manifest? And if the answer is yes, and there's symptoms present, well, we probably don't need a breath test. We can look at these other assessment methods and start to get answers related to the diagnosis, but we can also begin to understand how do we move forward with the treatment process. And about that treatment, here's our last point today, guys. Let's talk about H. pylori first. The conventional approach to H. pylori as far as a treatment is looking at antibiotics. And the question that always has to be answered here is it aggressive enough? I mentioned triple therapy earlier on, and triple therapy ultimately led to, because of resistance, to quadruple therapy, and has now even extended out beyond that to where we're looking at potentially 4 antibiotics along with an acid blocker being used in some scenarios. You don't really need to know anything about medicine and healthcare as a whole to recognize that there's a lot of inefficiency in that approach, and that's really just kicking the can down the road and not acknowledging the bigger problem that needs to be addressed here. So when we look at this conventional approach, we see that 14-day strategies outperform 7-day strategies. So this goes back to the whole mindset I mentioned earlier that don't go half-hearted when you start to try to deal with this organism. Go all in and be aggressive. See the course through to make sure that you are eradicating this organism. And that's the conventional approach, but what about the complementary approach? More of what we might think about as the nutritional supplementation strategy. So a couple of things on this. So we can intervene with the probiotics. So here's a bit of a different approach for us. And probiotics are interesting here because they can actually be used alongside antibiotics, timed differently, or they can be used alongside more supplementation, botanicals, if that's the approach preferred. And even in some situations, they may act by themselves or can be used by themselves. So hear me out on this. So when it comes to probiotics, they can be promising and they can help ultimately, big picture, restore the gastrointestinal balance. And you'll see that that's a theme when it comes to H. pylori. If we can maintain stability in the stomach and create a more optimal environment, H. pylori doesn't tend to proliferate and flourish in that scenario. And it ultimately prevents, the probiotics, they are ultimately going to prevent this explosion of bacteria that shouldn't inherently be there. And it's going to do this, these probiotics do this through both direct and indirect inhibitory effects. So remember earlier I said H. pylori is increasing inflammation. Probiotics are decreasing the inflammation. They're bringing it down. They're working against it. They're going to directly produce antimicrobial substances. So these are going to inhibit the growth of H. pylori. That's going to protect the mucosal barriers, the mucus, the mucus areas, the mucus layer there. It helps keep that mucus layer intact so that H. pylori doesn't have direct interaction with the cells in the stomach and begin to affect those. And remember, H. pylori has to bind. So let's say it works its way through that mucosal layer, then it has to bind directly up against those cells. Probiotics inhibit that binding ability of H. pylori to those cells. Now, it inherently, let me make some clarity here as to how we might use this, because I want to be fair to this conversation and not overhype it. And to do that, we need to recognize that probiotics are not generally effective as a standalone for eradication. They can work as a standalone more in helping prevent recurrence, but just by themselves, you're not going to compare them against antibiotics. They're not going to work the same way, okay? That's why they could be used more as an adjunct versus as a replacement. And some of the probiotics that we would consider here, and personally I'll start out with the one that I would look to first with patients, that's Saccharomyces boulardii. That organism has such an extensive amount of benefit, and we'll talk about that one more in the future. I think that one definitely deserves its own video just because of how much impact it can have. But Saccharomyces boulardii is a beneficial fungus that does show benefit against H. pylori. On the bacterial side, more of what we tend to think about with probiotics, so your beneficial bacteria, Lactobacillus species are often what are focused on here. The more specific, just to get into the weeds for just a minute here, Paracacia, Reuteri, those are the strains of Lactobacillus. Those are the subspecies of Lactobacillus that you want to look for there. Now, the probiotics, if you're on an acid blocker, PPI, generally the acronym that's applied here, these can be taken with PPIs and they can be taken with antibiotics. They may change the outcomes on the antibiotics, but what I think is really more of a standout as to why you would want to consider these with antibiotics, it's no secret that antibiotics come with a list of side effects: diarrhea, nausea, vomiting, pain in the abdominal region just below the rib cage. Those things are not atypical when it comes to taking a course of antibiotics. The use of probiotics can offset those side effects. So this may be more even so of the reason that you would want to take a probiotic in these scenarios is because you potentially reduce those side effects that are often seen with the antibiotic. And can they be used in kids? Well, absolutely they can be used in kids. That's been shown to be safe. Now, what about the treatment for SIBO? Well, to me, this one is a bit more straightforward. And let me say one last point that before I transition, before I leave H. pylori, I didn't elaborate on the fact that botanicals can be used for H. pylori. A combination of botanicals used more aggressively And also one that's looked at very often here is one that's known as mastic gum. Mastic gum is good, but an intervention for H. pylori should not be limited to mastic gum. There's numerous other botanicals that have shown benefit against H. pylori. And the point here is that the combination, just like we talked about with the antibiotics, more antimicrobials is going to be more effective and prevent resistance. So generally higher dosages on the botanicals, on the herbals for at least 30 days is my personal recommendation on this, and where you're going to, in my observation, see the benefits. Okay, that's H. pylori. Let's move on to SIBO here. So the treatment for SIBO is going to look different. In terms of antibiotics on this, we see that rifaximin is the antibiotic of choice. That's the one that's often prescribed here. There are definitely limitations with rifaximin that are coming more to light, and same scenario, combinations often work better. So whether it's rifaximin with metronidazole or some other antibiotic combinations work better than isolated antibiotics. All right. Now, that same theory, same strategy works for antimicrobials. And I'm biased on this, I'll admit that, but I think that there is more of a place for antimicrobials when it comes to SIBO, especially because you can introduce multiples of antimicrobials at one time. You cannot worry about running into the side effects. Now, granted, when it comes to antibiotics for SIBO versus antimicrobials or botanicals, there are far more studies on the antibiotics. But the anecdotal evidence on the use of antimicrobials is very robust and very positive. And so when they're dosed optimally in an optimal time frame, which is generally going to be 4 to 6 weeks, you want to go long enough, but not too long. That's when you're going to see the best outcomes with the botanicals, and they shine. Probiotics, if we're looking at non-conventional interventions here for SIBO, probiotics have a place here as well. Saccharomyces boulardii, again, at the top of the list on this. Saccharomyces boulardii has been shown to have some impact on SIBO by itself as a standalone. It's even more powerful when it's used in combination with antimicrobials, botanical antimicrobials, and other interventions. And we'll also see Lactobacillus plantarum as another bacterial species that can be a benefit. And remember, part of this treatment process for SIBO needs to include supporting the digestive secretions and supporting motility, because those are ultimately the underlying theme of what is wrong here. SIBO is often looked at as just a microbial issue, but as you can see, there's a lot more here than just a microbial issue. Now, if your presentation sounds more like SIBO, well, let me introduce to you the perfect way to resolve that, and that's going to be the SIBO solution. I wanted to make sure that you knew about this, and this is a program that I custom designed just for you to tackle all 3 phases of the condition and prevent relapses. You can find out more about that in the description below. But you can even get a preview by seeing my exact treatment to SIBO naturally that I use consistently with success by clicking on the video on the screen right now.